Dr. Pankaj Kumar, working as a junior consultant cardiologist in Narayana Health in Jamshedpur. It is city in Jharkhand. I just give you a latest update in hypertension. Now, introduction. As per WHO, nearly 63% of total death in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects 45% of people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for cardiovascular diseases. Moreover, it remains poorly controlled due to the lower awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has gone up to over 30 years to 38% in men and 32% in women, for 29% and 28% respectively. WHO, despite that, nearly half of the people are 51% of men and 41% of women with hypertension were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control pressure in a fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. This was published in WHO Lancet 2021. International Society of Hypertension has released the 2020 Global Hypertension Practice Guideline. The inclusion of optimal and essential treatment strategies attempt to address the issue that in resource poor setting, optimal care to evidence-based standard care out, and whereas essential standard refer to minimum standard of care to allow a specifications of essential standard of care for low resource setting. The AHA-ACC had released a scientific session statement in 2021 offering new guideline for management of stage 1 hypertension among people with low atherosclerotic cardiovascular risks. Among low risk adults, no ASD or over 10 years CVD risks less than 10% with stage 1 hypertension, blood pressure 130 to 139, systolic and diastolic 80 to 89 mmHg. Management start with non-pharmaceutical therapy. If blood pressure remains uncontrolled at 3 to 6 months, considering start pharmacological therapy. Acute respiratory distress syndrome is a potential fatal condition involving lung damage. An expert often associate with severe COVID-19. A recent study, which appeared in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. This was published in Call Cardiolol 2021 September. Lowering systemic blood pressure targets down to 110 to less than 130 range substantially reduce severe adverse effect in the stepped randomized trial, affirming the sprint finding for an older Chinese people among some 8,500 patients, age 60 to 80%, 80 in China. The intensive target trimmed 26% of the composite CVRX. Finding for now and second major trial support a lower target could the guideline, which even amongst US professional society range from threshold of 130 to 150. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guideline on the management of arterial hypertension recommended that the diagnosis of hypertension should not only be dependent on office BP measurement, but also an out of office measurement, such as ambulatory BP monitoring or home blood pressure monitoring. 24 hours and nighttime BP management were associated with risks of mortality and composite of severe outcome. Thus, they may be considered as the most relevant measurement for estimating severe risks. For every 20 by 10 millimeter increment in BP measurement at night, the risk of mortality increased by 23% and risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guideline equally recommended 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guideline recommended, especially in the context of lowering BP target, to start antihypertensive therapy with initial drug fixed dose combination of AC inhibitor or ARB plus calcium channel blocker or diuretics. Since early July 18, products containing valsartan have been recalled worldwide. The reason is the detection of known carcinogen, namely N-nitrosodomethylene NDMA, which can be found in candy sartan, irbisartan and losartan, olmesartan and valsartan. NMDA has been classified by WHO, International Agency for Research on Cancer, by carcinogen in human. If 1 lakh people would have received NMDA contained valsartan from Zhejiang Huzhai manufacture site where the highest level of contamination was found every day for 6 years in the highest dose, it could result in 12 additional liver cancer over the lifetime of this patient. The presence of NMDA in the drug could lead to 8 additional cancer cases in 1 lakh patients if they have taken the highest daily dose over 4 years. Valsartan recall accompanied by significant increase in the rate of emergency department visit of plus minus 6%. The HYGEA study represents the largest study that tested nighttime antihypertension treatment. In this trial, coronary therapy was associated with significant reduction in the endpoint, including death. The HYGEA coronary trial tested whether nighttime therapy is comparison to usual upon awakening hypertension therapy exert a favorable CVDs reduction. The largest study in the included a total of 19,000 hypertensive patients during an average follow-up 6.3 years. More than 1,700 participants experienced a primary CV outpoint, and ambulatory PBP management was performed for 48 hours to collect data on home BP different during sleep. The respiratory rate reduction for CV event was significantly improved for nighttime treatment when compared with awakening treatment. That's all. Thank you.